My name is Carol Peloso. I'm an ophthalmologist and I work in the Solomon Islands.
I'm Robert Ko from Papua New Guinea. I'm a consultant working with the National Department of Health.
My name is Nico. I'm the consultant in the Vanuatu Port Vila.
I'm Dr. Alma. I'm from Fiji. I'm there practicing and working as a general ophthalmologist, practicing comprehensive ophthalmology.
I'm Dr. Nola Pikacha from the Solomon Islands. I'm currently working at the Pacific Eye Institute with the Fred Hollows Foundation, New Zealand.
I'm Manoj Sharma, consultant ophthalmologist in TTM Eye Hospital in Apia in Samoa.
My name is Dr. Antonio Taufaitea. I'm from Tonga. I'm an ophthalmologist. Recently started working in 2023.
My name is Duke Mataka. I am an ophthalmologist in Tonga.
My name is Jambi Garab. I'm an ophthalmologist. I'm currently based at the Port Moresby General Hospital.
Being here at the workshop has been very helpful for me personally, and also to take home key messages that I've heard throughout the morning session, and to see that issues that we face in the Solomons are faced elsewhere, and to be able to see what they are able to do, what innovations that they are able to do with the issues that we also face.
It's a really great experience for me, and I will take the experience and challenge back home and be able to teach the young registrars to do what they do back in Papua New Guinea. Yeah.
And also, it's been always a great pleasure that I can listen to the other peers that deliver the presentations. And there's a lot of things that learn from this conference, and a lot of things that are valuable to take back home.
We're very grateful for this workshop and for being able to be given a voice and a forum with which to voice our challenges, our needs, and not only that, we're heard.
I'm very pleased to see and know about the RANZCO and one unit there of RANZCO who is actively involved in Pacific nations for the eye care of their population, and so many programs, so many workshops, so many training programs, and help support with the equipment, instruments, and planning, advocacy. That is very important.
For this Global Eye Health workshop, I thought it was a good chance for me to share what I have, what I've learned through the short period of time that I've worked in Tonga and also in Fiji. I thought it was a good thing for us to actually portray what we have in the Pacific so that others will learn.
I think Global Eye Health workshop is always interesting because it talks about low-income countries and their settings and how they manage eye diseases. It is really helpful to see other countries and how other low-income countries deliver their services in their settings.
Coming here and meeting, other people, networking is also really important for us. And RANZCO also supports our, continuing medical education by giving us the link for the sessions that go on online, and that's been good.
It's been a great opportunity to network for future plans, and we are excited in the Pacific for plans for further collaboration and enhancing the eye health, and especially into subspecialty visits in the future and training for our ophthalmologists in the Pacific.